And I'm going to toss it over to Sarah. So Sarah, welcome, and it's all yours.
Everybody, I'm happy to be here. My name's Sarah Martinez. I'm going to be doing a presentation that I did in the family education program a lot. So I worked at Caron from 2012 to 2020. And I worked primarily in the family education program. So I had the privilege of working with family members and doing a lot of educating on what is addiction, and then how does a family member respond to addiction. So I'm going to dive into the presentation here. This presentation, I do talk about and do a little educating on addiction itself, substance use disorder, and then but most of the focus of this presentation is going to be, well, what does the family do about that? So like Mallory said, if you have questions, I'm more than happy to answer them at the end. I usually ask that you try not to ask me personal questions about my life and my recovery. I also ask that if you're going to ask questions that are about your specific situation or treatment questions, some of those I can't answer. So, but if you have general questions about the presentation itself, I'm more than happy to answer those questions for you. All right, and you might have caught that. Most people, I think, if you've seen me before, you know I am in recovery, and I do use elements of my story to highlight what I think is kind of abstract concepts. But that being said, again, please don't ask personal questions at the end. I usually just start with that, and then saves me from having to say it a bunch of times later. Okay, so we'll jump in here. All right. So like I said, we're going to be talking about addiction, powerlessness, and family recovery in this presentation. All right, so to start, what I'd like you guys to do is imagine that you are standing and looking out at a frozen lake. Okay, so this is not skating on. You don't know how thick the ice is. You don't know how thin the ice is. This is not a lake that you want to walk out onto. Okay, and imagine you have a family member, someone that you love and care about, whether it's a spouse, a parent, a child, a sibling, and they're wearing these heavy chains, okay? And the two of you are looking out at this frozen lake. So I'd like you to imagine like what it would feel like if you saw your loved one who wears these heavy chains step out near the lake, like very close to the edge of the water. Just some of the ways that would like feel in your body. Would you be feeling anxious? Would you be minimizing it? Like, that's no big deal. They're probably just curious. Maybe you'd actually approach the lake yourself and say, I want to look out here too. This is no big deal. Okay. Like all the different ways that you might feel that in your body, and then how you might cope with those feelings, right? Now imagine if you saw your loved one who wears these heavy chains step out onto a frozen lake, right? So what are some of the things that you might feel if you witness them do that? And again, this is pretty individual. I think a lot of people might feel like if it was your child, you might feel immediately very anxious. If it was a partner, you might feel kind of angry. Like, what are you thinking? Why would you do that? Okay. Now imagine that you are standing at the edge of a frozen lake and you see your loved one wears these heavy chains standing out in the middle of a frozen lake, like far away from you. Okay. And so what are some of the things that you would be thinking or feeling? Okay. You might be thinking, please stop. How did this happen? Why is this happening? Why are you doing that? You might be feeling terror or anger. You might be thinking, how can I help? What can I do? Right? You might be propelled into action yourself. Okay. A lot of people describe feeling powerless. All right, so and if I was in the situation, I imagine someone who I love and care about standing out in the middle of a frozen lake, right? I think that I would probably be feeling mostly fear and a sense of helplessness or powerlessness. So powerlessness is a word that comes up in recovery a lot, especially if you're around or familiar with the 12 steps. So this is a loaded word. And so when I'm using the word powerless, I want to make sure that I'm as clear as possible about what I mean when I'm talking about powerlessness and addiction. So I'm going to start by describing powerlessness from the perspective of an addict. And then we're going to go into powerlessness from the perspective of a family member. Okay, so to start, just a little bit about substance use disorder. So this is described in the DSM as a maladaptive pattern of substance use leading to clinically significant impairment or distress. Okay, so simple little sentence there. But I can tell you, in working with addiction and also experiencing it in my life, I found addiction to be incredibly confusing and hard to understand. So when I was in my alcoholism, I did not understand why I was doing the things I was doing, and my family certainly did not understand it either. For me, a huge part in treating alcoholism was understanding what it was that I was up against. And so this little sentence here, while it's a good description, doesn't give me enough information about what addiction is. You're going to notice that I use the word addiction, alcoholism, and substance use disorder interchangeably. And I don't mean to confuse anybody when I'm doing that. I'm talking about the same disease, regardless of whatever someone's drug of choice is. Substance use disorder, whatever the chemical is, I'm talking about the same thing, the same cycle. Okay, so the model that I'm going to be describing should be applicable regardless of what the drug of choice is, whether it's alcohol, opiates, marijuana, stimulants. And it's also should be relevant not just currently in 2023, but what addicts and alcoholics have experienced throughout human history. So I usually like to start my presentations with just like a little bit of context. So alcoholism and addiction is not a new phenomenon. Okay, so since alcohol existed, alcoholics have existed, which means there's been people like me who cannot leave it alone, regardless of the consequences or the desire to stop. And throughout human history, we have baffled people with our behavior. And I think it's important to know that prior to really like the around 1950, maybe a little later than that, there really wasn't treatment for alcoholism or addiction. So in the medical community, if you were diagnosed as like a chronic alcoholic, you were considered doomed. Okay, so the outcome was typically jails, institutions, or death. We have known that addiction and alcoholism is a chronic disease. We know that it's progressive, which means it gets worse over time. And once you're in the grips of it, it is really, really hard to get out of it. And so, 200 years ago, if you were diagnosed with this, there really wasn't a ton of hope for recovery. So that's, I think, pretty heavy. If an addict or an alcoholic was able to put down the drink or the drug for a period of time, they were typically referred to as a dry drunk. And if you haven't heard that phrase before, a dry drunk is someone who is kind of like fighting themselves on a day-to-day basis, sometimes a minute-to-minute basis, not to pick up a drink or a drug. Okay, so we say like white knuckling it. They're really fighting hard not to pick up. And they're usually a pretty unhappy person. Okay, and you can imagine, I don't know if anyone's experienced anything like this, but if you're just spending like every moment of your day trying not to drink or smoke or use, okay, but none of the other behaviors have been dealt with, none of the other emotional issues have been dealt with, none of the trauma has been dealt with, right? And you're just fighting yourself. It's pretty unsustainable. So even if you're able to be a dry drunk for a period of like a week, a month, a year, it's usually a matter of time before that person falls off the wagon. And most people are familiar with what that means, that it's usually just a matter of time before somebody relapses. So throughout human history, if you're diagnosed as an addict or an alcoholic, right, you were considered, the outcomes were not great. If you were able to put down the drink or the drug, if you were able to do that for a period of time, pretty miserable during that period of time. And usually it's just a matter of time before you fall off the wagon. Okay, so it really didn't look good for addicts or alcoholics. Now, this all changed around the 1950s, where a group of alcoholics kind of put together some pieces of a puzzle, and they were able to create a program, essentially, of recovery that others could also do. So it translated, they passed it down, and that group of 100 alcoholics ended up writing a book. That book is known as Alcoholics Anonymous, otherwise known as the Big Book. And from there, AA and all these other 12-step groups kind of took off. And since then, we also have learned a lot more about addiction. We've learned a lot more about trauma. We've learned a lot about recovery. So today, there really is paths to freedom from addiction that just didn't exist, 200, 150 years ago. But I think it's important to keep in mind that this isn't like a new phenomenon. The way that I teach or explain alcoholism and addiction to people is by describing it as a two-part disease. And the first part that I talk about is the body. So the body of an addict or an alcoholic has a different physical reaction to drugs and alcohol than the body of a non-addict, non-alcoholic. And we see evidence of this different physical reaction when an addict or an alcoholic takes their first drink or their first drug on a clean system. So it's the first drink of the day, the first hit of the weekend, the first use after 6 months clean and sober. So we're introducing a chemical into a clean system. What's going to happen inside the body of an addict or an alcoholic is they're going to have an acute physical craving for more that surpasses mental control. And that's not happening in the body of a non-addict, non-alcoholic. Okay, so what that looks like is when an addict or an alcoholic has a sip of beer, a drink of wine, a hit of their drug of choice, even if they say, I'm just going to have 2 drinks or I'm going to have 3 hits or whatever, they can't predict with any validity how much they're going to have once they start. Okay. This is probably one of the, in my opinion, the biggest red flags that you can recognize in the early stages of alcoholism and addiction. All right. So it's not so much about how much a person is drinking or how frequently a person is drinking, although that's important information. But if you can't predict how much you're going to have once you start, okay, if once you put a drink or a drug in your body, right, something awakens in you and it wants more, that's an indication that something else might be going on. Okay. So we describe that as a craving. So I try to be, just when I'm presenting on this, I'm being specific. When I use the word craving, I'm not talking about someone who's in rehab and sober or clean and thinking about drugs and craving drugs. When we use the word craving, or when I use the word craving, I'm talking about when you've had a drink or you've used a substance and something awakens in you and you're craving more. So, and that's really ignited the moment an addict or an alcoholic introduces a chemical into their system. Okay, so again, it's described as acute physical craving for more. It surpasses mental control. And in the 12-step literature, it's described as an allergy. And so the reason they're using the word allergy is because they're describing this as an abnormal reaction to a common substance. Okay. So Dr. William Silkworth, this guy is, if you're not familiar with Alcoholics Anonymous, William Silkworth is Bill Wilson's doctor. So Bill Wilson's one of the co-founders of AA. And he was the guy who explained to Bill Wilson about kind of the physical abnormalities that have to do with the disease of substance use disorder. So he described it when Bill Wilson and the 99 other alcoholics wrote the big book. He wrote the foreword called The Doctor's Opinion. And in that he said, they all have one symptom in common. They cannot start drinking or using without developing the phenomenon of craving. This phenomenon, as we have suggested, may be the manifestation of an allergy, which differentiates these people and sets them apart as a distinct entity. It has never been, by any treatment with which we are familiar, permanently eradicated. The only relief we have to suggest is entire abstinence. So what he says is that he identified something called the phenomenon of craving. He calls it an allergy. He says it's different. It's a distinct entity, which means it's not happening in non-addict, non-alcoholics, and that the only relief is abstinence, which means there's no such thing as using in moderation. There's no such thing as drinking in moderation once you're diagnosed. Okay, so those are like 4 pretty important points. All right. So here in this model where I say start, what I mean is you take the first sip, the first hit, the first pill, whatever. So that's when you're introducing a chemical into what was a clean system, you start the cycle, okay? And from that chemical hitting your bloodstream, you have an abnormal reaction to a common substance. We call that the phenomenon of craving, right? And I think it's important to say that drugs and alcohol are common substances. Okay, so most people drink alcohol and enjoy it. Lots of people use other substances and enjoy those too. Many people are going to abuse or use very heavily, I'll say, like drugs and alcohol. Okay, but an addict and alcoholic is going to have an abnormal reaction to this common substance. And the way I describe this is I usually talk about my friends from college. So I partied heavily in college alongside my peers. And if they were to describe their experience with alcohol or drugs, it would look very different or sound very different than the way I describe my experience with alcohol and drugs. Okay, even though we were both partying heavily. So if I asked my girlfriend, all right, what does it feel like for you when you drink alcohol? What they would say is that it was a pleasurable feeling. They feel like their inhibitions are going down. They feel like a little bit funny, a little weird, a little out of control. The more they drink, the more out of control they feel. And after a period of time, they're really just feeling like not like themselves, out of it, confused, maybe nauseous or tired. Okay. So that's not the experience that I'm having when I drink alcohol. Okay. To say it's a pleasurable feeling would be a pretty, like, that would be an understatement. When I drink alcohol, it's like my mind expands. I can think clearly. I feel interested. I feel motivated. I feel connected. I feel more, the more I drink, the more in control I feel. And over time, I'm feeling more and more normal, corrected, content. My peers are experiencing with drugs and alcohol, even though we both would be, on the surface, it looks like we're both partying and having a good time. So when a non-alcoholic drinks alcohol, they feel intoxicated. But when an alcoholic drinks alcohol, they feel corrected. And that's an abnormal reaction to a common substance. Okay, so first, we'll look at the chart. A non-alcoholic will drink. There's a pleasurable feeling. I've heard people describe it as like a warm feeling and kind of like your inhibitions going down. Maybe you're feeling like more social than you usually do. But like as you drink more, so if you're on your 3rd or 4th glass of wine, you maybe are kind of starting to act a little silly. Maybe you're feeling like not like yourself anymore. Some people don't particularly like this feeling, from what I understand. So you're feeling more confused or disconnected or just weird or out of control. Now, some people do like this feeling, okay, of like being intoxicated. I can tell you that just by the way this is described to me, I don't think I would like that at all. I like to feel in control. But I want to also say that there are people who drink heavily who enjoy that feeling. Now, if we look over here at the alcoholic or the addict side, you put the drink or the drug in your body and you're almost immediately feeling a craving for more. So we have that phenomenon of craving kind of turn on. And as you drink or use more and more, you're feeling in control, empowered, connected, normal, and content. So these are 2 different experiences that you're having now, but both people, the non-alcoholic and the alcoholic, on the surface are looking probably like they're having a good time. And so there's this disconnect in understanding where a non-alcoholic really doesn't and can't relate to the experience of the alcoholic and vice versa. All right, so here we go. We put that drink or the drug of the in our body, and we have that phenomenon of craving. And now because of that, because we're feeling corrected from the substance, we're usually drinking or using more and more, and we start to experience what we call unmanageability. This is kind of like the recovery word for consequences. So addicts and alcoholics start to accumulate consequences as a result of chronic substance use. And what's interesting, and part of the way that we can diagnose alcoholism and addiction, is if there's an accumulation of consequences without a behavior change. So if you get a DUI from drinking and your behavior changes, you cut back on drinking and you never do that again, okay, that even though you got the DUI and that's a terrible thing, right, that would indicate that you learn from a consequence. Multiple DUIs or the loss of jobs or many relationship issues. So it's sort of like when you're looking at it from the outside, the behavior can look really confusing. Like, why isn't the addict or alcoholic learning from their mistakes? Some examples of unmanageability would be hangovers, blackouts, risk-taking behaviors, injuries that you experience during drinking or using, lying, cheating, stealing, money issues, relationship problems, fights, academic issues, hygiene issues, sexual risks, legal problems, overdoses, health problems, and accidents. We could definitely add more to this list, but this is just some examples. Some of the things you'll start to see accumulate for an addict and alcoholic without a behavior change. Okay. So because most addicts and alcoholics that I know are pretty intelligent, strong-willed, reasonable people, and you're starting to accumulate these consequences, the next thing that happens is you stop. Okay. So maybe one day you wake up in the morning, you're sober, there's no drugs or alcohol in your body, and you're like, I humiliated myself again. I lied again. I cheated again. I stole again. I hurt myself again, whatever it is, you're starting to feel the weight of these consequences on your shoulders. So what you do as a strong-willed, reasonable, intelligent person is you're going to try to control your substance use. So addicts and alcoholics almost always, as a result of starting to accumulate consequences, will start to cut back. They'll try to control, they'll make substitutions. That would be I think someone mic is on. Hold on. I don't know. I can't tell who it is. If you guys could just double check that your mics are off. All right. And so and finally, an addict and alcoholic almost always will make a resolution. So after they've tried to cut back, control, and substitute, after they've done all the things like I'm only drinking on Tuesdays, I'm never starting before 5, I'm only smoking marijuana, I'm only using when I'm with my friends, I'm taking a break for a month, I'm only drinking when I'm wearing purple. Okay, whatever it is that you do to try to control yourself, eventually you'll make a resolution. You'll say never again. Okay. The idea that someday, somehow he will control his drinking or using is the great obsession of every abnormal drinker. The persistence of this illusion is astonishing. Many pursue it to the gates of insanity or death. We addicts and alcoholics are men and women who have lost the ability to control our drinking, and we know that no real alcoholic ever regains control. Okay, so the question is how do we go from this place where we've stopped, okay, and we are sober, there's no drugs and alcohol in our body, we're not experiencing the craving for more, okay, we've tried to cut back, control, and substitute, we've made a resolution to never do it again. How is it that we get from this place where we stopped to the place where we pick up again, right? How does that happen over and over and over? And that happens when we're sober, okay? So there's no drugs or alcohol in our system every time we pick up that first drink or that first drug. So really, this is the crux of the problem, is what's going on inside the mind of an addict or an alcoholic when they're clean and sober that gets them to pick up a drink or a drug again, okay? So that's the mental part of this disease. And that's really what we want to kind of understand. That was the hardest thing for me to understand as an alcoholic, was what was happening for me in between episodes of drinking. Okay, so addicts and alcoholics, this is a quote from Alcoholics Anonymous. We are unable at certain times to bring to our consciousness with sufficient force the memory of suffering and humiliation of even a week or a month ago. We are without defense against the first drink. Okay, so the first drink is the problem, and there are times when we are without defense against it. Can't bring to our consciousness with enough force the memory of how bad things were, right? And the reason that is, and the reason that we end up picking up again is because sobriety is uncomfortable, okay? If you have this disease, sobriety does not feel good. If you just have, and when you drink, you're overdoing it, or you drink a lot, but when you're sober, you feel fine, you're not thinking about drinking or drugging, right? Then you're missing the whole bottom half of the cycle, and it's probably relatively easy for you to stop. But for an addict or an alcoholic, sobriety is uncomfortable. And so even when we're sober, we are suffering from the disease of addiction. So sobriety, if I had to describe it, I'm experiencing dread, shame, guilt, future tripping, which is like a fixation on the future or what's coming next. It feels like you're constantly waiting. The big book says restless, irritable, and discontent. We feel uneasy. We need external things in order to feel okay, whether that's like food or relationships or another fixation or another addiction, okay? Most addicts, alcoholics describe feeling kind of empty or alone, even when you're surrounded by people who you love. Mood swings, needing distractions, resentful, anxious, and preoccupied. Okay. Sobriety feels like a discomfort with the movement of time. And we are seeking relief from this. So most addicts and alcoholics, yes, we like drinking and using to a point, but a lot of times the main motivation for us to pick up a drink or a drug is because we are seeking relief from the experience of sobriety. So in the mind of an addict or alcoholic, we've got guilt and shame. We have a lack of coping skills. We have a discomfort with the passage of time. Often we're struggling with other compulsive or addictive behaviors, full of resentment and fear, having mental cravings. So these are called obsessions, which means we're thinking about drinking and drugging all the time. We're glamorizing it, which is very common for addicts and alcoholics. We bring to our mind the memories of the times it was good, even if there was only like 3 times that it was good, and we have 1,000 times when it was bad or we embarrassed ourselves. We're going to remember those 3 times it was good with a lot more clarity, and that's called glamorization. And finally, we struggle with something called the addictive voice. So that is a part of the mind that is relentlessly firing out reasons, excuses, justifications to pick up and drink again, or to pick up and use again. And it's sometimes like all day, every day. Okay, some examples of the addictive voice is that it'll be different this time. It wasn't so bad. I can have just one. I deserve it. I can control it. I'm not as bad as my friends or so-and-so. Nobody gets it. Poor me, like kind of like self-pity. There's no point in trying. I can handle just one. Tomorrow I'll stop. This is impossible. Nobody will know. And addiction isn't a disease. And that's just firing out those types of excuses like pretty relentlessly a lot of the time. Okay. It's the curious mental phenomenon that parallel with our sound reasoning. So parallel with maybe if you have 100 reasons not to pick up again. So parallel with your sound reasoning, there inevitably ran one trivial excuse. So there inevitably is one dumb idea. Okay. Our sound reasoning fails to hold us in check, and the insane idea wins out, which means that if you are a sober addict or alcoholic, all you need is one dumb idea and it trumps all. Okay, and trust me, as an alcoholic, I can say I had more than one dumb idea, but all you need is one, and it kind of is like then the dam breaks, and usually you're going to pick up that first drink or that first drug again. But in the meantime, as long as you're fighting yourself, you're miserable. Okay, you're a dry drunk. So here we go around the cycle. So first we pick up a drink, or we have the first sip, pick up a drink, have the allergy, experience consequences. So we stop. When we're stopped, sobriety is uncomfortable. We're obsessing about drinking or drugging. The addictive voice is firing out excuses. Eventually, the dam breaks because we're so uncomfortable sober. And we go through this cycle over and over and over again. Okay, so this is what it means to be powerless as an addict. We have a body that cannot tolerate drugs and alcohol, and a mind that cannot stay sober. Okay, and we're stuck in that cycle. Nowhere here are we feeling good. Okay, and nowhere here is there like a way out. Body that cannot tolerate drugs and alcohol, and a mind that cannot stay clean and sober. So here's some quotes from the big book that I think just kind of paint a nice picture of what it feels like to be an addict or an alcoholic. So we have lost the power of choice in drink. And when you accept that or understand that, it's really significant. So I know like the last institution I was in, I knew I was going to drink again, even though I didn't want to drink again, because I had no choice. That's what it feels like. So our so-called willpower becomes practically non-existent. We will be unable to stop drinking on the basis of self-knowledge. Cannot trust your brain to keep you sober. The organ you use to think with is diseased. That's kind of the first step of Alcoholics Anonymous, is accepting what you're powerless over. You can't trust yourself to keep you sober because your brain has the disease. So you can't trust your brain to keep you sober. We know that willpower, morals, values, self-knowledge, promises, losses, intelligence or IQ, memories, desire, pain, humiliation, resolutions, control plans, and love for family does not work if you're trying to recover from alcoholism and addiction. All right, so you can't will yourself to be a non-alcoholic. You can't love your mom enough to be a non-alcoholic. You can't have embarrassed yourself enough to be a non-alcoholic. All right, that's just not how we escape the cycle of addiction. Right now, there is a way out of this. I think it's important just to see what it is that an addict or an alcoholic is up against. Okay, but the way we know that this stuff doesn't work. Okay, but what does work is really seeking help outside of yourself. Okay, so whether we talk a lot about the 12 steps. The 12 steps is an excellent way to kind of break the cycle of addiction and get help outside of yourself. The first step in the 12 step is we admitted that the solution was not inside of us. We admitted we were powerless. That's really a pretty significant component of recovery from alcoholism and addiction. It's just recognizing the pickle you're in, right? Because the disease of addiction kind of tells you that it doesn't exist. A lot of addicts and alcoholics struggle with minimization and denial. It's a kind of a part of the disease process. So the first step is really stepping out of denial, stepping out of minimization, and recognizing that you're stuck in this cycle and that you on your own are not going to get out of it, that you're powerless. But step 2 is willing to believe there is a solution. So you're not doomed in that cycle, but you need to do something to get out of it. You need to ask for help. So step 2 is I'm willing to believe there's a solution and it's outside of me. Okay, I'm willing to believe that others know the way out and I'm willing to ask for help. Okay, so we start to see if someone's kind of moved through those first 2 steps, you see them taking suggestions, following instructions, being honest, open-minded, and willing, and embracing this aspect of powerlessness. So powerlessness does not mean that you're helpless. It does not mean that you're doomed. It's really about accepting what you can't control and accessing power a different way. Okay, so through that brief presentation, I know I covered a lot. My hope is that you maybe understand the chains that an addict or an alcoholic wears, and what it means to be powerless, what it means to be standing out in the middle of a frozen lake. Okay. Now, but here we still have the family member, right? So the family member standing there looking out at the addict, the alcoholic who is struggling. And this is often how families will describe like what it feels like for them. Well, I'm standing on the shore and I'm looking out there and I see my loved one on a frozen lake and I don't know what to do. Okay. And this is what it means to be powerless as a family member. But I think most people who work in treatment would actually describe it a little bit different than this. So the family member is not necessarily standing out at the shore, looking out at their loved one, feeling powerless. They've usually run out onto the frozen lake in order to try to help their loved one. And they're still feeling very powerless. They still can't get their loved one off the frozen lake. Okay, and so this is how people who work in alcoholism and addiction would describe the family crisis. So the family is out on the frozen lake, not just the addict. Okay, so if I try to imagine the scenario, if I see, for example, one of my kids out on a frozen lake, right, I'm probably going to run out onto that frozen lake, right? That's not the smartest or safest or best strategy, but just in an effort to try to get to them or help them or get them off, right? In an effort to try not to feel so helpless, that might be like the knee-jerk reaction that many family members will have. Okay, so you run out there, you try to help. Okay, but now the family is out on this frozen lake and they're suffering, they're alone, they're scared, okay, feeling isolated, and everyone's out on the ice. So what does that mean? What does it mean for the family to be out on the ice? So if you're wondering, okay, if you have a loved one who is struggling in addiction right now, and you're wondering, have I run out onto the frozen lake with them? You might be on the ice if you're denying that there's a problem, if you're fixing things, if you're threatening, if you're lying, if you're bailing them out, if you're covering up for them, if you're co-signing bad behavior, if you're manipulating them or people around you, justifying, controlling, avoiding, obsessing, minimizing, blaming, criticizing, lecturing, micromanaging, chaperoning, bribing, isolating yourself, engaging in rescuing behaviors, snooping, following, or enabling. So if you can look at some of these behaviors and see yourself in some of them, you may be standing out on the frozen lake. Okay. The last one I have here on this list is enabling. And then obviously that's kind of a broad term. So what does it mean to enable an addict or an alcoholic? Well, the first thing that I always say about enabling to try to reduce feelings of guilt and shame, if anybody has those, is that enabling is a natural and normal response to the disease, to any disease, but it's, to the disease of addiction as well. So it's a way that you try to care for an addict or an alcoholic, and it comes from love. So, if you're a family member and you go, oh my gosh, I think I've enabled my loved one, it's a normal response and it's done out of love. And it just so happens that with addiction, this disease thrives in an environment where there is an enabler. Okay, so this disease does really well if there's an enabler around. So that's why we educate family members on what enabling is, and we try to present it in such a way where you can see it and make a decision if you want to engage in that behavior or not. So enabling, when you're trying to help an addict or an alcoholic, some of the times that's by kind of addressing or relegating or minimizing the consequences they're experiencing because of their addiction or the choices they're making. So enabling often looks like you're kind of making things a little bit easier for them, because you're going, oh gosh, they're already so stressed or they're already so sad. They already have so much on their plate, so I'm just going to kind of do this for them. So you might be taking on some of their responsibilities, paying some of their bills, maybe lying for them or covering up some of the things for them, protecting them. Sometimes, or I would say a lot of the times, enabling has an element to it where you're trying to control the person a little bit through the enabling behavior. And often, if you get very honest with yourself, it's done for your own relief. So the family member often feels like they're just feeling so out of control or powerless or helpless that by doing something that feels like you're helping the addict or alcoholic, you feel like you have a little bit more control. So you feel some relief. Okay, and again, enabling is going to create an environment where addiction can thrive and progress. Some of the effects of standing out on a frozen lake. So not only is it not great for the addict or the alcoholic, but the person who's standing out there with them is usually struggling with obsessions, consumed thoughts, dread, sleeplessness, loneliness, shame, guilt, neglecting other responsibilities. Often family members will describe feeling like a loss of self, like they kind of aren't sure who they are, feeling very disconnected from their life, their hobbies, their friends or family, lots of terror or anxiety, impact on the family relationships, and Also, it has an impact on the addict. So it doesn't have a positive impact on the addict, and here's why. Imagine that you're standing out on a frozen lake and someone runs out there with you. All right. What they're doing is they're adding more pressure to the ice. Okay. So really the worst thing that you can do if you're trying to help someone who's standing out on a frozen lake, the worst thing you can do is run out there with them because you're adding more weight and more pressure. Okay. By standing out there, your life is also in peril, and other family members might run out there because you ran out there, and this will add even more pressure to the ice. Okay, so the only way that you can help an addict or an alcoholic, again, you cannot get them off this frozen lake. They are chained out there. You cannot get them off. So the only way you can help them and yourself is you have to get off the frozen lake. Okay. Now, this feels really awful to family members. When we're saying like, you've got to prioritize yourself and taking care of yourself and getting yourself to safety, because you cannot get your loved one off the lake. There is a way to help them, but it's not by standing out there with them. So step one for a family member is pretty similar to step one for an addict. The solution is not inside of me. So I cannot get my loved one off the frozen lake. And you also have to kind of acknowledge that you're out there. All right. Now, if you're a family member and you've identified, okay, I'm standing out on the frozen lake, I'm adding pressure, I need to get off, it's the only way I can help my loved one and myself, you have a problem, right? Because you don't know how to get off this frozen lake. You don't know where the thick parts are, and you don't know where the thin parts are. So I wouldn't recommend just walking yourself off. Okay, usually people can't do that. So first we have to kind of look at the three, these are the 3 C's of Al-Anon. And this is part of the step one process for family members. I am powerless. I did not cause this. I can't control it. I can't cure it. And what that kind of translates to in our analogy is I did not put my loved one on the frozen lake. I cannot carry them off this frozen lake, and I cannot break their chains. All right. And now if you sit and let yourself feel that, like some people are going to read this and feel relief, like they're off the hook. Okay. I didn't cause it. I can't cure it. It's not, I don't have the power to do that. Right. Some people are going to read, I can't carry them off the lake, I can't break their chains, and just feel even more afraid. Then what can I do? All right. But this is the first step in family recovery, is recognizing what you can and what you can do to help and what doesn't help, what you can control and what you can't control. So step 2 for a family member is the same as step 2 for an addict. I'm willing to believe there's a way off the lake. So I'm willing to believe there's a solution. I'm willing to believe that someone can help me off this frozen lake. Okay. And what you start to see if someone has moved to kind of this step 2 is they start asking for help. So here we have, let's say this person here is a support group, a therapist, Al-Anon, Families Anonymous, a Caron parent group. All right, and they're going to say, look, we know this frozen lake. We know where the thick parts are. We know where the thin parts are. We have a rope, and we're going to help guide you off this frozen lake. All right, so again, support groups, professionals, self-care, detachment, education, community resources. This is all the ways that you can look for help to get off the frozen lake. But what this feels like to most family members, not all, but to many family members, when you start going to support groups, going to therapy, practicing self-care, setting boundaries, detaching, getting educated, using community resources like this, what that can feel like is almost like abandonment, right? Like you're trying to get yourself off the frozen lake and you're leaving your loved one out there. And so I want to acknowledge that that is something that family members who start their recovery process often struggle with. But if you look at this picture, right, that's not what's happening, okay? This is not abandonment. This is a family member who's doing the hard thing, the courageous thing, the brave thing, And really the only thing that's going to help the addict or the alcoholic, it is not abandonment. Okay, it feels like it, but that's not what it is. So part of the way that, or one of the ways that we recommend getting support, which is a huge part of family recovery, is through resources like therapy, Al-Anon, Families Anonymous. Families Anonymous is typically for if it's your like your child or someone kind of in your nuclear family. Al-Anon is anybody, a friend, a partner, a coworker who's struggling with addiction and you don't know how to deal with it. You can go to Al-Anon. Nar-Anon is if your loved one is a drug addict. There's Caron parent support groups, ACOA, which is adult children of alcoholics, AA, and also Celebrate Recovery. These are just some examples of getting support. So once you're on dry land, so now you have exited the frozen lake, you've kind of entered into your own recovery process. Now you are in a position to help. Okay, so here you have enabled yourself to be a support person to the addict or the alcoholic without making things worse. Okay, and I've made an acronym to try to help people remember the ways you can help an addict or an alcoholic without enabling them or without stepping onto the ice. So I call them the AID rules. All right. So the first one is, and this is how you help an addict or an alcoholic, is allow for consequences and learning. And this can be hard, you know, and this is an example of something where you really have to use your discretion and use your support network if you feel conflicted on what you should and shouldn't allow. So this can be challenging if it's your spouse in particular, because if you allow for your spouse to experience some consequences, a lot of times you're going to experience those consequences as well. So you want to use discretion. Also, if it's your child, it can be really hard to let them experience some of those consequences depending on what they are. So inspire. So the messaging and the attitude that we like people to have towards an addict and alcoholic is you are capable. Like we know that this is hard, but you can do it. So addicts and alcoholics sometimes are going to fight recovery. They're going to think it's impossible. They're going to think it's too hard. They're going to feel like there's no way that they can live their life meaningfully without substances, perhaps. So the message is, yeah, it's going to be hard, but you can do it, right? Yeah, this isn't easy, but you are absolutely capable. People do recover. This is not an untreatable condition. There are recovering people all over, and you are capable of being one of them. So demonstrating, so instead of nagging an addict or an alcoholic about going to therapy or going to a meeting or practicing self-care or being healthy, just demonstrating it in your own life. So you're going to meetings, you're using your network, you're talking to a therapist, you're going for a walk every day, whatever it is, you're demonstrating instead of nagging. Refer to professionals when you don't know what to do. So in this journey of recovery, it's not laid out for you. It's not right or wrong. There's a lot of gray. And if you're feeling like you don't know what to do or you're stuck, there are professionals that you can reach out to and get support. So when you're overwhelmed or you don't know how to help your loved one or they needed additional help, you know, don't hesitate to seek help outside of yourself or your support group. Untie yourself from the addict or the alcoholic as best you can. So really what this looks like is you're not going to rely on the addict or the alcoholic to make you feel okay. So again, this often takes work in therapy, learning about your personal attachment style. If you have work to do from whether it's your childhood or within your marriage or as a parent, learning how to detach yourself in relationships so that your well-being is not contingent on the well-being of somebody else. And so it becomes much easier to help them effectively, and in a way that where you're not just trying to help them so that you don't feel so bad if you have untied yourself. To learn how to love without fixing. So I love you, and your problems are your problems to solve. They're not my problems to solve. Sometimes that looks like, even if you're the addict, the alcoholic in your life calls you with a problem, that you just listen and validate without jumping in and offering solution or doing something for them. And embracing powerlessness. So understanding that they are out on a frozen lake, they have those chains, and that you're not the one who's going to carry them off the lake. And finally, self-care, whatever. I mean, self-care is a very broad term, and becoming intentional about that and making that a priority is something I think is a skill that everyone can practice, but it becomes very important when you're engaging in a program of recovery, or when your life's in some type of a crisis, which it often is if you have someone who you care about who's in active addiction. If you're standing off the frozen lake and you're on dry land, you are no longer alone. So you are not isolated out on a frozen lake. You're surrounded by peers and family and professionals and a support network. Okay, and are ideally starting to heal. Okay, and if they see you starting to heal, it's going to be appealing to them as well. So through therapy, support groups, communities, step work, reading, self-care, spiritual growth, education, okay, etc., we can begin to have serenity again, which just means we can have peace in our life. We can be okay, even if there's someone in our life who we care about who isn't okay. So this is what family recovery looks like. Boundaries are what help you to stay off the frozen lake. So if you're standing on dry land and you're having the urge to run out there again, boundaries are ways that you can keep yourself kind of safe. And the best way to approach boundaries, or at least to conceptualize them, if you're confused on boundaries, is that they're not about changing the addict or the alcoholic. So a boundary should never be about trying to manipulate the addict or the alcoholic to stop drinking or using, or go to more meetings or something like that. A boundary is the focus is on you and creating well-being for you. The focus is on self-care. The focus is keeping yourself on dry land. So that needs to be the intention behind the boundary. Okay, and the message is also one of like, you are capable of doing things on your own. So if you have a boundary that's like, I'm not going to pay your bills for you anymore, right? It's not a threat. It's not an ultimatum. The message is, I think you can pay your bills yourself. I think you are capable of paying your bills yourself. And I need to keep myself practicing a program of recovery so I don't get enmeshed or engaged or resentful and go back onto the frozen lake. So like the mantra that you hear at Caron a lot is, I will not enable your addiction, but I will support your recovery. Sometimes, especially early on for family members, this is a hard line to walk. It can feel very confusing. When am I enabling their addiction and when am I supporting their recovery? And that's why we say, if you're confused or you're not sure, use your support, ask a professional, and really don't beat yourself up if you feel like you make a mistake. Okay, this is a journey, and there isn't like a right or a wrong. It's more when you step back. Before you engage with an addict and alcoholic, you step back and you pause and you check your motives, you check with others, you think about your intentions, and overall, like conceptually, you're able to hold some of these concepts in your mind about addiction, what addiction is, about what family recovery is, about what enabling is, as you're continuing in your relationship with an addict or an alcoholic. We want you to feel good about supporting the addict or the alcoholic, and at the same time feel confident that you're not contributing to the progression of the disease. So if you're over here on dry land, you're having some serenity in your life, right? And that looks appealing to the addict or the alcoholic. But who's going to help them get off the frozen lake and break those chains is people who've done it before. So the addict alcoholic is going to be seeking their own community, their own therapist, their own recovery path. And they're going to be looking at people who have the same chains as them, who are standing in front of them with freedom. And if your addict alcoholic is interested in that, if they're interested in living a life where they're not bound by these chains, where they're not standing out in a frozen lake, there are people everywhere who are going to be willing to help them and show them how they broke their chains. And they're going to help them off the frozen lake. So I'm hoping with this kind of brief presentation, you guys feel like you have a better comprehension of addiction, compassion for the addict and the alcoholic, but also compassion for yourselves and for family members, you know, how painful and isolating and complicated addiction is. So just some compassion for the process and what it's like, and also some hope for the future. Again, you know, addiction and alcoholism, these are treatable conditions. There is absolutely hope for recovery, but not just for the addict, for the family system as well. So I like to end my presentations with the serenity prayer. This is just something you hear a lot in recovery circles. So grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. All right. So that's it for me. And what I'd like to do is open it up for